she's ideal for thread lifting because she has a slim face, so there isn't that much subcutaneous fat that we need to lift, and she has moderate laxity. So our plan is to put a couple of easy threads on either side to lift the cheek, and these will be inserted in a U-shaped fashion. For the lower face, we will have parallel mint threads again, which are the cog threads. The threads are within a cannula, and so we will place them, the fine, in 3 sections here, parallel, to lift the whole jawline and the marionette line. And at the same time, we will have another 4 threads below the mandibular border to lift the neck. So this is going to be the pattern of insertion. So with the easy on the upper face and the fine mint threads in the lower face, which is what is recommended by the company. Typically this is rather uncomfortable, so we will put little bits of little threads of anesthetic along each one of these lines to make the whole process much more bearable. So we're going to do a little bit of anesthetic. First of all, we start with infra-orbital block from the cutaneous aspect, just to make the patient more comfortable. And then we will add boluses of anesthetic at the entry points of our needle and cannulae. And finally, we will just give threads of anesthetic along each planned line of a thread insertion. To allow the thread to pass through. Okay. Cog network, and in the middle there is a plain part. So part of the thread is plain, and you have the cogs on either side, and you have of course the 2 needles. Okay, so we have to insert give me a cap.
Cap.
Sorry, assistant. Just need to check it's free. Okay, here we are. So part of the cogs are inside, and we go thread through until we reach the plain part of the thread. So this is in the middle. And now we have to go through the same opening and pass the needle towards the, here, give me the right, yeah, it's better. You okay? Here we are, and the thread, the needle is actually in the superficial subcutaneous layer, just under the skin. I need the cap. far that actually. I'll just hold it for a second. So this is the U configuration. So you have kind of an anchoring here, at least a little on the zygomatic arch. So we have to cut the threads. It's quite long. Now we put in the cannuli. There is a little dimpling, but the dimpling will resolve in a little while. Okay, so of course here, but you can see that the whole zygomatic arch is more contoured on the treated side as compared to the other side, untreated side. Is it clear? So the cheek has been lifted and contoured. These are the fine threads, and the fine threads are within a cannula. You can see the cannula is blunt and it's held in place by this little plastic plug. So we have to make an opening with a needle which is sharp, and through this opening we can put one or two threads. We can put each thread from one opening, or we can put two threads from the same opening. So you just wiggle slowly, pushing the cannula through, and we can check all the time, lifting to make sure that we are in the subcutaneous layer. So here we are. You can see how we have to lift. We can lift the tissue with the thread. It has a very powerful grasp, and this is due to the good quality of the cogs, the sculpted cogs. A characteristic of a good thread in that you cannot pull the thread out once it's been gripped into the septal bands. So you can see that the grip is very good, and you can even not pull out the thread even if you try. So now we're going to place the second thread just beneath the first one. Okay, towards the mandibular ligament, and that's it. Now we have two in. And now the third one. It's a very simple procedure, very low risk, as long as one is in the layer of the superficial sub-Q. So never to go deep. So now 3 threads from the same opening parallel to each other. And you can see that it has a very nice tightening and lifting effect on the tissue. So that's it. You have some people like to tie at least a couple of these threads together, or you can simply just leave the threads and cut free floating in the tissue. So these are done. Now the threads that are for the neck. Can you give me, dear, the fine from here? So they're fine. Another bunch. Okay, 1 and 2. You're okay?
Yes.
Okay. This is the first one. Next one. Okay, that's it. And the last 2. It's quite a easy
Easy.
procedure,
Easy.
especially with these threads. Sorry, I didn't.
Easy. Easy and quick.
Very quick. Here we are.
And the last one.
Okay. We're done. This side is done. I think I will tie these threads together. What do you think? Hmm? Okay. The light, please, dear. One done, yes, one has to go.
This is the gun.
Let's just set her up before
Cannula,
the
18 gauge.
the one that I just used.
Okay, open this one.
But let us set her up first. Let us take a photo before the swelling sets in. Okay, can you sit up?
الدقن المزدوجة أو الدبل تشن، كمان نستخدم خيوط الفاين، الثريدز الفاين، مشان تساعدنا على شد الجلد المترهل بالرقبة طبعا. That's it. الخيوط.
اوكي خلينا ناخذ لك صورة بس.